I am Dr. Cassius Camden Clay. I invite you to be a member of our Strong Club. Members of our club use a unique system of quick self-fix techniques that wake up weak sleeping muscles and immediately make them strong. Most people, even world-class athletes, have a significant number of muscles that test weak. Olympic athletes, large muscle bodybuilders, they all test weak. If you are not a member of our Strong Club, you probably have a lot of muscles that will test weak also. These muscles are not weak because you need more exercise. These muscles are most often weak because of connective tissue tightness and joint fixations that are disrupting blood flow, lymphatic flow, and/or nerve conduction that is necessary for muscle strength. These muscles have gone dormant to conserve resources. They are hibernating like a bear in the winter, sleeping to conserve. I'm going to teach you how to wake these weak muscles up and make them instantly strong and keep them strong. The standard belief that the only way to make weak muscles strong is by exercising is false. We now know that we can make significant weak muscles instantly strong and keep them strong using specific connective tissue stretches and joint motions that we do to ourselves, the quick self-fixes. The connective tissues that we focus on stretching include ligaments, tendons, and fascia. They are a complex network of intertwined layers of Spider-Man strong spiderweb-like tissues interweaving themselves in a matrix that connects and holds everything in the body together. Finding weak muscles and making them strong is most valuable because of the following reasons. It increases vitality. It improves physical and athletic performance. It helps prevent injury and helps heal existing injuries. It helps resolve pain and increases overall comfort. It helps slow the development of arthritis, and it burns fat. Hibernating muscles do not burn as much fat as active muscles. Think about it. I developed these quick self-fixes by using muscle strength testing. Repeatedly, quick self-fixes make weak muscles strong. I have pinpointed 31 easy-to-learn muscle tests. Of these 31 muscle tests, I have discovered 24 of them. This is truly unique information. When you experience these weak muscles becoming instantly strong using quick self-fixes, you will be motivated to use the quick self-fixes regularly. I've written 2 books with accompanying DVDs on this important information called Quick Self-Fixes and Targeted Muscle Testing. In these books and DVDs, I teach you how to perform these 31 muscle tests and make them instantly strong and keep them strong using quick self-fixes. As an introduction to these discoveries, I am teaching how to test 5 of these easy-to-learn muscle tests and associated quick self-fixes for free. Your success in making these 5 muscle tests strong using quick self-fixes will be phenomenal. Please pass this important information on to your friends. Quick self-fixes are worthy of going worldwide to reduce suffering and improve physical performance for our human family. Learning quick self-fixes and muscle testing from a DVD and book is like learning yoga from a DVD and book. It does not replace a live teacher. We invite you to attend quick self-fixes and targeted muscle testing workshops for better competency. Come to us or bring us to you. See www.quickselffixes.com or call 404-808-4280 for information on classes and on ordering books and DVDs. You may choose to only learn the quick self-fixes for yourself, or you may choose to learn both quick self-fixes and the muscle testing to amaze, educate, and help others. If you work in a related healthcare field, you may choose to integrate quick self-fixes and muscle testing into your profession. If you find this technology amazing and you are compelled, you are welcome to apply to join our team of certified targeted muscle testing and quick self-fixes practitioners and workshop leaders and help take this new paradigm worldwide. Following is a brief demonstration of quick self-fixes and targeted muscle testing with Daryl Stafford.
My name is Daryl Stafford, and I have been a competitive bodybuilder for 25 years. I started off as an amateur and worked my way up to a national competitor.
This is a test for the biceps muscle. And palm up, arm parallel to floor. I'm checking initial strength and he doesn't even have initial strength on that side. So, coming back around here, when the biceps brachii long head goes weak, it's most commonly caused by a subluxated bicipital tendon, where the tendon goes through the bicipital tendon groove and over the humeral head. It gets hung up in there. If it could hold, it would tear, so it does not hold. The quick fix-it for this, Daryl, is you're going to take your thumb and go right over your humeral head and push as hard as you can toward the opposite side, pushing that way. Then you're going to fish flop your hand behind your body and unkink that tendon. So you can start right here, over the humeral head, push as hard as you can that way, let your hand rest here, and now fish flop that hand behind your body. Go palm up, and I'm checking your initial strength, which before you didn't have it. You do have it. I'm going to check your core strength now. Hold strong. He's got his core strength, and hold strong now. Daryl has his sustained strength. That worked. Awesome. Let's get started. First, muscle testing people where they are injured can make them worse, so don't do that. Second, pain during a muscle test makes a muscle test invalid. People will generally not hold strong even if they could when the muscle test causes pain. Also, pain indicates potential harm, so don't do that either. And third, it is very easy to overpower a strong muscle and make it appear weak by using too much force and/or speed. Muscles have several reflex systems which abruptly make strong muscles go weak to prevent injury when the muscle is being physically overstressed. You want to gauge the power differential between you and the person being tested, meet them at their level of strength, and then increase your challenge incrementally to gently challenge their muscle strength. We are gathering information. This is not a power struggle to see who can win. We are evaluating their degree of specific muscle strengths and weaknesses as objectively as we can. Have a friend or friends who are studying muscle testing with you validate your muscle testing findings. They should find exactly the same muscle weakness that you have discovered and later confirm that weak muscles have become strong through the use of quick cell fixes. There are 3 levels of muscle strength that we challenge. The first level is initial strength. If the muscle does not have initial strength, it immediately goes weak, and if a muscle tester is too forceful, it may even hurt. This is why the first test must be a very gentle trial test to confirm that the muscle has the initial strength to safely withstand a core strength muscle test. The second level of strength is core strength. If core strength is present, the muscle tests strong. If core strength is not present, the muscle may initially appear strong and then suddenly go weak during the first 2 seconds. The third level of strength is sustained strength. When core strength is present, the muscle appears strong. This third test challenges the muscle for a couple of seconds longer, testing the muscle's endurance for no more than 4 seconds. When the muscle passes the sustained strength test, it is confirmed strong beyond a reasonable doubt. To start your initial muscle strength test, first explain the muscle test so the person you are testing will know exactly what to do during the test. For example, which way you are going to push or pull, which way they will resist the push or pull, where and how you're going to brace them so they don't lose their balance or move inappropriately during the muscle test. Just prior to actually doing the test, say, hold strong, give them a second or less to respond. When you feel their muscle engage, immediately match your pressure to their strength and only then gently increase your pressure. If the muscle being tested is unable to meet your mild pressure and falls weak, that means the muscle does not have initial strength. It is very weak and the test is over. Remember, I am teaching you how to test muscles where they are chronically found weak. Be careful and be gentle. If this muscle does meet your mild pressure and thus has initial strength, you are then free to test the muscle for core strength. Repeat the exact same test, incrementally increasing pressure for no more than 2 seconds. If the muscle goes weak during these 2 seconds, well then, it's weak. If the muscle tests strong, it has core strength. Do one more similar test using a little more pressure for up to 4 seconds. This tests sustained strength. If the muscle remains strong, this confirms beyond a shadow of doubt that this muscle is indeed strong and has endurance. Do not get confused. We will review these concepts over and over during our muscle testing demonstrations. Sometimes, even though a previously weak muscle now tests strong, areas may continue to be painful. The body needs time to clear away inflammation and heal. I much prefer a patient leave my office and say, "Hey doc, it still hurts," rather than, "Hey doc, it's still weak." When the patient's muscles are made strong and hold strong, the odds are high that they will get well. Sometimes the biggest issue in learning muscle testing and teaching quick self-fixes is finding people to practice on. Be brave. Ask people for help. They will volunteer. They will help you. Remember, this is amazing muscle testing fun. This is my friend Christy. Thank you for helping me, Christy.
It's my pleasure.
Muscle testing is a science and an art. When I say hold strong, I wait for Christy's muscle to engage before I meet her pressure and strength. Hold strong. Good. Furthermore, once her muscle has engaged, if I go suddenly, quickly, and with force, hold strong, the muscle goes weak, it has been overpowered. This is the art. Take some practice. Hold strong. Good. Now, there are 3 levels of strength that we challenge with each muscle test. The first level of strength is initial strength. Is the muscle functioning? Hold strong. When there is not initial strength, the muscle just goes weak with very little challenge. The muscle test is now over. The second level of muscle strength that we challenge is core strength, which is challenged by meeting Christy's strength and adding just a little more pressure for 2 seconds. Hold strong, 1, 2. Christy has her core strength. The third level of strength that we challenge is sustained strength for the count of 4. Hold strong, 1, 2, 3, 4. Sustained strength proves beyond a shadow of a doubt that the muscle is indeed strong. Following are 5 targeted muscle tests and 5 quick self-fixes for the shoulder joint. This is the test for the biceps brachii long head. That muscle is right here. Christy, keep your arm parallel to the floor. When I'm testing, I'm not pushing down on her hand. That would be an invalid test. I'm pushing down on her wrist. I'm going to brace Christy right here on her shoulder. If I don't brace there, if I just push down, say hold strong, push down, Christy's going to fall forward. So I'm bracing, arms parallel to the floor. I'm going to test initial strength. Hold strong. Christy has initial strength. I'm going to test core strength. Hold strong. Christy has core strength. And now hold strong again for sustained strength. Hold strong. 1, 2, 3, 4. Christy has sustained strength. Pause and test the biceps muscle on the other side. Were that muscle weak, Christy would do the bicipital tendon fix to make biceps brachii long head strong. And that fix is done. Christy knows this one. Go on and do it for us, Christy. Thank you. This is the bicipital tendon fix. This fix makes the biceps brachii long head muscle strong. Tendons connect muscles to bone. This is the bicipital tendon. It connects the biceps brachii long head muscle to the front of the shoulder blade. This tendon goes through a groove in the humeral neck and a groove in the humeral head and traverses over the humeral head before it attaches to the scapula or shoulder blade. On its journey, sometimes this tendon gets fixated. When it is fixated, biceps brachii muscle does not hold strong. This fix is wonderful for improving range of motion in the shoulder joint and for resolving shoulder pain. You start with the shoulder, with the arm of the shoulder that you're going to fix, with the hand touching your thigh in front. The motion is going to be bringing this hand up, palm going out with the hand going behind your body, just like that. It's going to start in front. It's going to end up palm up behind your body. The most important aspect of this fix is a strong pin. The thumb from the opposite arm comes over the humeral head and pins that bicipital tendon by pushing the thumb towards the opposite shoulder. It's a very firm pin. You're pinning the tendon and then you're rolling the bone under the tendon. It's going to look just like this. Your thumb's parallel to the floor. It comes over the humeral head, down to the humeral neck. Commonly people pin too high up. Be sure your thumb comes all the way down to the humeral neck and pushes extremely firmly toward the opposite shoulder. This is my right shoulder. I'm pushing firmly towards my left shoulder. My fingers are touching my shoulder here for stability. Now, with this very firm pin, very super firm, I'm going to flip this arm behind my body, shoulder, external rotation. That's it. That miraculously makes the biceps brachii long head muscle strong. Arm parallel to the floor. Hold strong, initial strength. Hold strong again, core strength, 1, 2. Hold strong again, sustained strength, 1, 2, 3, 4. And that concludes this test. Here is the test for the anterior division of supraspinatus, right here. This is one of the 4 rotator cuff muscles. Christy's palm is facing behind her. Her arm at her hand to hip is about 30 degrees. I'm not pushing on her hand. I'm pushing just above her wrist, pushing her hand towards her hip. My hand here stabilizes her opposite hip. I'm pushing her arm towards her body and hold strong. When it goes weak, it just goes weak. And now hold strong again. Initial strength is present. Hold strong again. Core strength is present. Hold strong again. Sustained strength is present. Pause and test the supraspinatus muscle on the other side. When this muscle is weak, the fix is the shoulder fix. This hand goes with this shoulder, this hand goes with this elbow. You're going to push straight up. You're not pulling out, you're pushing straight up toward the sky, and then once you're at maximum tension, there's a very gentle set. So turn to your side this way and do the shoulder fix for us, Christy. Good, thank you. Put the hand of the arm that you want to fix on the opposite shoulder. Hold the elbow of the shoulder you are fixing. You want to hold the elbow in where it stays close to your body, close to your rib cage. Using this hand, lift the arm and shoulder upwards toward the ceiling as far as it goes without pain, and now give a slight and gentle lift just like this. That was it. That makes the rotator cuff muscles instantly strong. And then to retest this muscle, supraspinatus, let your arm in just a little bit. Hold strong. I'm going to push this hand towards your body. Initial strength, and hold strong. Core strength, 1, 2, and hold strong. Sustained strength, 1, 2, 3, 4. Great. We have the test for the belly of the middle division of latissimus dorsi, and that muscle section is going to be right there. Once again, her arm is straight, her palm is facing backwards, her hand from her hip is about 20 degrees out. I brace her hip with the back of my hand, and I'm going to pull straight towards me. Hold strong. When it goes weak, it does just like that. And hold strong, initial strength. Hold strong again, a little more force, 1, 2, core strength, and hold strong again, 1, 2, 3, 4, sustained strength. Pause and test the latissimus dorsi muscle on the other side. The fix for this muscle is the latissimus dorsi fix. There are trigger points between the ribs underneath the breast. Between the ribs, they're going to be very tender points. You just fish around right under the breast at the nipple line, searching for very tender points, and you massage them. Certainly stay within your comfortable threshold. Sometimes this is a little painful, so be kind to yourself. There are two reflex points that are located on the front of the rib cage just under the pectoralis major muscles, in line with the nipples, and sometimes to either side of that line. Search for tender points in this general area, stay within your acceptable pain threshold, and massage these spots for up to 10 seconds. This completes the latissimus dorsi fix. And the retest, I'm bracing your hip, your arm is straight, your palm is facing back, your thumb is pointing in, 20 degrees apart here, and hold strong. Initial strength, hold strong core strength, and hold strong sustained strength. Here is a test for upper trapezius, scapular division, medial zone. That muscle section is right here. Now, Christy's arm is straight and it's at this angle. Her palm is facing down. I'm contacting not on her hand, just above her wrist. Most importantly with this test, her whole arm crosses her midline. So, when this muscle goes weak, hold strong, just drops down just like that. And hold strong, testing initial strength. And hold strong again, testing core strength. And hold strong again, testing sustained strength. 1, 2, 3, 4. Pause and test the muscle on the other side. When this muscle is weak, the fix is the cranial fix. Take your little finger, put it on your frontal bone. Take your ring finger, put it on your sphenoid bone. Take your middle finger, put it on your parietal bone. Take your index finger, put it on your temporal bone. Take your thumb and put it on your occiput. Now, it's not vitally important that you have these points exactly right. Just look at where I'm touching, and being close works just fine. Do both sides of the head at the same time for 10 seconds. Here is the cranial fix. Take your little finger, place it on your frontal bone. Take your ring finger, place it on your sphenoid. Take your middle finger, place it on your parietal bone. Take your index finger and place it on your temporal bone. Place your thumbs on your occiput and hold extremely light and extremely gentle. It's okay if the finger placement is not exactly perfect. This fix works anyway. Hold very gently, very tangentially, very softly. Christy's arm is straight and it's at this angle. Her palm is facing down. I'm contacting not on her hand, just above her wrist. Most importantly with this test, her whole arm crosses her midline. When this muscle goes weak, hold strong, just drops down just like that. And hold strong, testing initial strength. And hold strong again, testing core strength. And hold strong again, testing sustained strength. 1, 2, 3, 4. Now we have the test for the belly of pectoralis major superior division. That's going to be right here. The arm is parallel to the floor with the palm facing out. The palm must be facing out with the thumb facing down. Cross the midline. Crossing the midline shortens this muscle to test the belly. I'm going to push this arm directly that way, keeping your arm parallel to the floor. Hold strong. That's how it looks when it goes weak. Initial strength, hold strong. Core strength, hold strong, 1, 2, and sustained strength, hold strong, 1, 2, 3, 4. Pause and test the pectoralis major muscle on the other side. And the retest of the belly of the superior division of pectoralis major. The arm is parallel to the floor, hand is facing out, thumb is facing down. I cross the midline, I'm pushing directly that way, keeping her arm parallel to the floor. Hold strong initial strength, hold strong core strength, 1, 2, Hold strong, sustained strength, 1, 2, 3, 4. This concludes 5 targeted muscle tests and 5 quick self-fixes for the shoulder joint. Have fun with it. This is amazing muscle testing fun.